You know, we always hear that phrase, movement is medicine. But what does that actually mean when it feels like your own body is working against you? Well, today, we're diving into a condition where that question is everything. Ankylosing spondylitis.
So, to really get why movement is so unbelievably important here, we first have to understand what's going on inside the body. What does it even mean to have a fusing spine?
Okay, so at its core, ankylosing spondylitis, we'll just call it AS, is a type of inflammatory arthritis, and it really likes to target the spine. All that inflammation can get so intense that the vertebrae, the individual bones that make up your spine, can literally start to fuse together. This is what leads to that unforgettable nickname, bamboo spine, because the spine can lose its flexibility and become stiff, kind of like a stalk of bamboo.
So who's most likely to be affected by this? Well, AS can happen to anyone, but the data from the studies we're looking at today shows a pretty clear trend. It shows up much more often in men, and the symptoms usually start kicking in during young adulthood.
All right, a condition that can literally reshape your spine. Yeah, that's going to require a really smart, comprehensive approach to treatment. And that brings us to a fascinating therapy that researchers have been looking into, one that treats the body as a single connected system. It's called Global Postural Reeducation, or GPR, and the whole idea behind it is to stop thinking about the body as just a bunch of separate parts. Instead, GPR sees the body as one interconnected whole. So instead of just stretching one tight hamstring, this therapy uses very specific postures to gently stretch and realign entire muscle chains at once.
And this whole method is built on three really simple but powerful ideas. First, individuality. That means every single person is unique, so your therapy should be too. Second, causality. The goal isn't just to chase the pain, it's to find and treat the root cause of the problem. And finally, globality. This is the big one, the understanding that everything is connected. A problem in your back might actually be starting somewhere else entirely.
So what exactly are these muscle chains we're talking about? Well, here are a few key examples. GPR focuses on big networks like the dorsal chain that runs all the way down your back, or the brachial chain in your arms and shoulders. It even works on the respiratory chain, which is so important for breathing, something that can get really restricted by AS. It's a truly holistic way of looking at the body. The theory behind GPR sounds pretty amazing, right? But, in science, a great idea is just the starting line. The real question is always, does it actually work? So let's see how researchers put this therapy to the test. Now, to get the most reliable answer possible, the scientists didn't just run one more experiment. They did something called a meta-analysis. Just think of it as a study of studies. They scoured all the existing research for the best, highest quality trials out there, and then they combined all the results. It's one of the most powerful tools we have in medical research. And their first search was huge. They pulled in 154 different studies that seemed relevant. But, and this is what makes this kind of science so trustworthy, they were incredibly strict. They had a really high bar for quality. After filtering out everything that wasn't up to snuff, they were left with just 4, the best of the best. This way, their conclusions are based on solid evidence. So, after all that hard work, sifting through hundreds of studies to pinpoint just those 4, what did the data actually show? Well, the result was a little surprising. When they looked at patients doing GPR versus patients doing other kinds of conventional structured exercise, they found something really interesting. For the big things, like reducing pain and making daily life easier, both approaches worked really well. GPR was definitely helping people, but it wasn't dramatically better than other good exercise programs. And that, of course, brings up a big question, right? If they both help with pain and function, is there really any difference between them at all?
The answer is yes, there was a difference, and it was in one really crucial area, spinal flexibility. The researchers used a simple test called the finger floor distance, which is basically just what it sounds like: how close can you get your fingertips to the floor when you bend forward? And in this specific test of spinal mobility, the GPR groups showed a significantly bigger improvement.
Okay, so let's zoom out from the specific data for a second and look at the big picture. What does all of this really mean for someone living with AS? The takeaway is actually pretty simple, but it's incredibly powerful. Your movement matters a lot. And this really gets to the absolute heart of the research. The main takeaway isn't that one single technique is some kind of magic bullet. The real message here is that for this condition, a consistent, structured exercise program, any proven kind, isn't just a nice-to-have, it's essential medicine. So what's the real lesson we can take from all this? Well, the successful programs in these studies had a few things in common. First, consistency is key. These programs ran for 3 to 4 months solid. Second, supervision helps. The treatments were always guided by a specialized physiotherapist. And finally, and this might be the most important one, health education is power. Just understanding your condition and knowing your options is the absolute best first step you can take.
So in the end, this research doesn't give us a single one-size-fits-all answer. Instead, it shines a big, bright light on a path forward. It shows us that guided, consistent movement is what's critical and that there are different, effective ways to get there. Which leaves us with the most important question of all. Now that you know this, what's the right next move for you?